Hi, everybody. My name is Joyce, and this is my presentation for osteoarthritis. Okay, so what is osteoarthritis? Osteoarthritis can also be referred to as degenerative joint disease. It is a gradual deterioration of the cartilage that cushions the joint, and it wears down the joint over time. So it's a non-inflammatory disease, and it is mostly common amongst the elderly, but it can also affect other people, usually people who've dealt with some kind of trauma or like injury. And it can be classified into two main categories. Primary being there's really no known cause as to why someone would be experiencing it, and secondary, in which there is a known cause, like we said, trauma or obesity or disease. So pain really is the main symptom of this disease. There's not really other symptoms. It just depends on what kind of pain the person is experiencing, which is by case. It depends on the case, and also how they feel the pain. And where. So the pain usually is in hands, knees, hips, neck, and the lower back. But pretty much everybody experiences this like background achy pain that doesn't really go away. It's just there all the time, pretty much, and it can be an intermittent pain. So it can come and it can go. There's not really telling when you can experience this pain. It progresses over time, so over time it can get worse and worse and worse. And um, the way it progresses can also depend on what kind of activities you do and kind of what your lifestyle looks like. If you were a patient that was obese, you would be putting more weight and more pressure on that joint, so you would be feeling more pain. And if, let's say, you didn't make a change, like lose some of the weight to take off that pressure and that weight off that joint, it would get worse and worse over time, more over time for that person. And it can also become worse with strenuous activities. Alrighty, so diagnosis. Laboratory examinations are probably the very first thing a care provider is going to do before they go and order like an x-ray or an imaging test. They're also going to look at like your family history. Patients that um, have a family history of osteoarthritis are at a higher risk. But also, sometimes there might be an underlying health issue that could be causing this, or health underlying health issue that could be making the symptoms worse. So laboratory examinations are going to be like the very first thing that they do, and then next are going to be like X-rays and imaging tests of the joint or in around where that pain is being felt. Alrighty, so treatment. Treatment includes many, many things, but one of the main ones is injection. They'll pretty much give you an injection right on that joint of wherever you're feeling the pain to help relieve some of that pain, but also oral pain relievers. Exercise to help build strength, flexibility, and balance, as well as brace or shoe inserts. Sometimes a shoe insert can be really, really helpful to relieve some of that pain in that joint. Also, possible weight loss. Like we said before, when you're overweight, you're putting extra weight on that joint, and that can cause it not only to progress over time, but it can cause more pain. So usually patients are put, or obese patients are put on a weight loss plan to help relieve some of that pressure off that joint. And this is a very, very last resort, but surgery. Okay, guys, and to conclude this presentation, osteoarthritis is a non-inflammatory joint disease. It is known as your wear and tear like disease. So it's pretty much the cartilage between your joints that cushions your joints wears off over time, causing some aching and pain. It can be diagnosed mainly through x-rays and other imaging exams. And treatments include shots into the joint and lifestyle changes to help manage the pain.